Is it possible to reverse painful hip osteoarthritis? Yes, it absolutely is possible. But let's get clear on something first. If you've been diagnosed with hip osteoarthritis, then chances are you've had an x-ray or some imaging where they looked at your hip joint that's painful and they found signs of osteoarthritis. Those changes on the x-ray that show the osteoarthritis are likely going to stick with you for a long time, maybe indefinitely. But what we help people with all the time is, despite having an x-ray that shows hip arthritis, they can get back to being healthy, active, and mobile, and they get back to doing all the things they love to do, even though they've had a bone-on-bone hip osteoarthritis diagnosis based on the x-ray. But ultimately, if you can do everything you want to do, and your hip doesn't hurt, and you're active and healthy, then why let the diagnosis stop you? Just because you had something on your x-ray that showed up, don't let that label you. Don't let that be a determination of what you can and cannot do, because if you fix the root problem and your hip joint's moving well and you have good mobility, you're able to be on your feet as long as you like, you're able to do the things that you enjoy doing with the people that you love, then keep going. Make sure you take care of your hip so that it's healthy for the rest of your life. For some people, having the diagnosis of hip arthritis is more crippling than actually having the problem itself. We regularly see people here in the clinic that come in with a diagnosis of bone-on-bone hip osteoarthritis, and after going through the treatment approach that we put them through to get the mobility back, to fix the root cause, to address the muscle imbalance, and get them back to doing exercises even, these people are not limited by the diagnosis, are not limited by age, are not limited by weight, or any other factors. They keep going and they disregard the diagnosis because they feel good. Now, it's another thing if you don't feel good, then you do have to do something about it. You do have to be concerned and worried. But if you're feeling well, move forward and live your life. So how does this work? How is it possible that exercise can reverse hip osteoarthritis? Let me explain the muscle imbalance. The most common imbalance that we see is that there's weak muscles on the backside of the hip and over-dominant or overly strong muscles on the front side of the hip. On the back side you have the butt muscles, otherwise known as the glute muscles. And then on the front side you have hip flexors, and some of these muscles go down into the thigh and they make up part of your quad muscles on the front of your thigh. And you also have some muscles in the back of your thigh right here. They're called the hamstrings, and there's some of those muscles that cross the hip joint and can influence it as well. When your muscles in your thigh, especially the front of your thigh, are very strong or dominant, because maybe you're not that strong, but you're using those muscles all the time, and you got nothing back here on the glutes. In fact, we see a lot of people as they get older, they lose their glutes, and they don't have good activity in their glutes. And that's a clear indication that this muscle imbalance is strong there, and it's causing the problem. What this muscle imbalance does is it causes the ball and socket joint to move differently than it's designed to. And this causes a lot of excessive pressure and irritation. And the inside of the joint is lined with cartilage, the ball and then the socket, and so it's designed to take pressures. But if you're putting too much pressure in a single spot because the forces of the muscles, the imbalance, are pulling it or pushing it in a direction that it's not supposed to go, and that's how you live and move, then it's just a matter of time before you irritate that spot, and if it doesn't have a chance to heal, it's going to wear down, become injured, and you can have some long-term impact because of that. And to fix this problem, all you have to do, there's a process though, is get better glute strength, not have these muscles be so dominant, and over time you'll allow that area to heal and be able to get all the mobility back, be on your feet as long as you like, and do all the things that you want to do. Now the question I get all the time is, why doesn't any doctor explain it this way? Most healthcare professionals out there, doctors, surgeons, physical therapists, the general healthcare professionals at large, are regurgitating to you what they learned in school, in their actual classrooms, in their medical programs, but as well as through their colleagues who train them. They're telling their hip arthritis patients, you have hip arthritis because, they're telling you the cause, because you're older and this is an age-related problem, because you're overweight and you're putting too much pressure through the joint. And the other one they say is, well, you've had other hip injuries over the years and now they've all compounded on you and they're coming back to haunt you. But that is the old way of thinking. You're likely not going to find many healthcare professionals that think differently from this. It's probably going to take a whole new generation of healthcare professionals coming in, thinking the way that I'm going to share with you here, before it's normal practice for people to heal their hip arthritis naturally without surgery. But I don't want to wait that long. That's a lifetime. I need you to get your hip arthritis better now so that you can avoid a surgery right now. So let me compare with you the old way of thinking with the new way of thinking so that you can see them right next to each other. Now with the old way of thinking, people will say, well, it's your weight that's causing the hip arthritis. This doesn't give you a ton of control because most people, if you have a few pounds to lose, you feel guilty about it because you've been carrying around that weight, but you're also stuck between a rock and a hard place, or you're caught in a difficult situation because you want to go exercise likely, but exercising causes you more hip pain. So what do? Because you want to solve your hip arthritis problem by going to go exercise, but then your hip's getting worse. What do you tell the doctor? And then when you come back to the doctor and say, well, I gave exercise a go, I tried it, but my hip's worse now. The doctor's going to think that you actually gained more weight because maybe you did. You didn't exercise as much. It hurt. This is not a good way of thinking. This is the old way of thinking. Now, the new way of thinking, this is the way that I share with all my patients, and I'm going to give you right now, is that unless you're 50 to 70 pounds or more overweight, it depends on your height. The taller you are, the more weight you have, the more margin you have. Then you probably don't need to lose weight right away. And what's more likely the case is you need to gain strength in those weak muscles. And if you can gain strength here in these weak muscles, then despite your weight, you're likely going to make your hip joint feel better. The more overweight you are, the more of a factor that's going to be on the actual hip joint. But what you have in your control is doing exercises right now that reverse the muscle imbalance to help to put the ball in the right socket to offload the hip joint so that you can allow it to heal. So I'm not going to shame you on your weight. And then there's another question related to this. What if you're thin? Because there's a lot of slender people that come into my clinic, don't have a pound to lose. In fact, they're usually trying to gain weight, and they have hip arthritis. And then they feel guilty because they're hearing mixed information saying, well, maybe I'm 2 pounds heavier than I should be. Christmas just happened and I had too much desserts and now that's why I have hip arthritis. It's not the case. It's that they don't have strength in the right area because of the way they've been exercising, or maybe they just haven't been exercising, and that's what needs to be fixed. The second way of thinking is the old injuries that come back to compound over time. Now, what they're saying is when you were a youngster, when you're in your teenage years, maybe when you were in high school, you played sports, you fell, you maybe did some activities when you were in your 20s and fell, you were a little extreme, and all those exercises that you did or all those extreme activities that you did, maybe you were rock climbing or riding motorcycles all the time or horseback riding and you had some falls here and there. Activities like those are the ones that doctors will look to blame as a result of your hip arthritis now that you're in your 50s, 60s, and 70s. But in reality, what I see is that it's rare that those injuries have true long-term impact. Maybe you did have an injury and it still did kind of bother you, but what's more likely the case is that that injury you had in your 20s just never got fully resolved, and it's still resolvable today. If you have good hip range of motion and your x-ray isn't absolutely atrocious and it absolutely needs to have surgery today, then chances are you can improve it despite all those old injuries, because that gives you control today. You don't have control over what happened, it's in the past. But if you can resolve the muscle imbalance today that maybe was added on by old injuries, but it's still fixable, then you don't have to worry about it and live your life thinking, well, all those years that I did sports, all those years that I ran cross country and did the 5Ks and marathons have caught up to me now, and now I'm going to pay for it and have to go through a hip replacement surgery. That is not the way to think about it. That is the old thinking. The new thinking, I've already kind of mentioned it, it's fix the muscle imbalance, restore all your motion, get your glutes very strong. Despite your old injuries, you can fix your glute strength, and that will improve the mechanics at the ball and socket joint to offload the joint and allow that hip arthritis to heal. And the last way, the third way, is doctors, healthcare professionals will often blame age. They'll say things like, well, you're no spring chicken anymore. You hit the big 70. Now everything's going downhill. If it doesn't hurt, it doesn't work. People say things like that. And the truth is, despite your age, you can improve hip arthritis as long as it's not end-stage hip arthritis, like I said. Well, that's because there's some severe changes that have happened and it's difficult to heal the cartilage at that point. But even if you're in your 70s, think about this. We have patients coming in here in their 70s and beyond, and time passes as we go through treatment. We're not going back in time. They're getting older, but they're getting better, and they're getting more active, and they're feeling great, doing things they love. It doesn't make sense, according to the old thinking, because they aged technically a few months while they were going through treatment, but they got better. So that's a myth. That's an old way of thinking. The new way of thinking, the way that I want you to think of today, is that when there's a muscle imbalance, if it doesn't get resolved over time, it irritates the joint. It just so happens that you age over time. So the old healthcare has thought to associate time with injury and age with injury. But you need to disassociate that. You need to pull it apart and think, I need to fix the root problem. And if I leave that there over time, it's going to get worse. And maybe another year will go by and I'm a year older. I cross 70 years old. But you need to instead think of it, let me solve that root problem so that when I cross 70 years old and beyond, I'm feeling even better. I'm feeling younger, actually. So I hope this helped you out. I want to give you the new way to look at it. And I need to tell you that you're going to be hard-pressed to find a doctor or a physical therapist that believes that. Most of them are going to say, well, it's a degenerative injury and it's because of your age and all the activities that you did, and plus you still have the Christmas weight from 10 years ago and you've added some since then. Things like that are not the root cause of this problem. You can heal your hip arthritis, but you got to fix that muscle imbalance. I talk all about it here on this channel. You can go see every hip arthritis video that I've ever made. It's in a playlist that I've linked in the description below. It's called the Hip Arthritis Help Playlist. And then the process, the treatment approach that I use to help somebody heal their hip arthritis, I've put it into a program called the Hip Arthritis Recovery Program. There's a link to that program in the description as well. That program walks you step by step through the entire process that I take someone through here in the clinic to help them heal their hip arthritis all the way through to the maintenance phase where they're able to exercise and do all the fun things they want to do without worry that they're going to be paying for it the next day with their hip, or that they're going to get to the next year of life and just be in a lot of pain. They're feeling fantastic. Most people are saying, I feel like I've unaged going through this process, like I've gotten younger going through this process because their hip feels so much better. Hey, if you thought this video was helpful for you, please share it with somebody you think needs to see this. Somebody who needs to learn the new thinking behind hip arthritis. And I'm not even afraid, if you want to share this with your healthcare professional out there, I truly hope that they see it so that they might be awakened to this line of thinking and start to make new connections about how hip arthritis works. And this is how arthritis works in other joints as well. This isn't limited to hip arthritis, but I love talking about hip arthritis. Please comment below if you have any questions. We love to answer the questions, and just share any stories of you healing your hip arthritis, because we know it happens all the time. We see people do it. And please don't forget to hit the thumbs up button, subscribe, and turn on the notification bell so that you don't miss out on any of the helpful videos that we share each and every week. I'll see you in the next video. Bye-bye.